Yes, ma'am.
Thank you, Phyllis. Thank you. Thank you. Okay. Everybody received their study guides, right? Whether it came from me or Dr. Kershaw. And if you would please put your name and your professor in the chat, that would be great since we take attendance at these. And I'd like Dr. Kershaw to know which of her students were there, and I'd like to know which of my students were here. So if you could all put your name and professor in the chat, I would greatly appreciate it. Okay, everybody has a copy of the study guide, is that correct? Yes or no?
Yes.
Okay, could everybody turn their cameras on, please? Please. Okay, and for those of you coming in, put your name and your professor in the chat. All right, I'm going to share my screen. I'm hoping to be, I don't know, 30, 45 minutes. I want to go through this study guide. We're not going to go through line by line. I'm just showing you how I organized it and where all the information is. It's broken out by weeks. I always tell students to, if they can, to print out the study guide and take notes on it. Okay, if you'd like to. So you can take notes on this review. You can take lecture notes on it, but this one should be kind of written all over. Okay. So a little cover page here. Obviously, study guide number 1, we're covering weeks 1, 2, and 3. And then I have copied and pasted all of the information, your reading assignments for weeks 1, 2, and 3. And just to be clear, for example, week 1, fundamentals book, med-surg book, community care website, okay, Healthy People 2030. But when it says C Canvas course, where is this information? Where are these 4 sheets that you're responsible for knowing? Where are those 4 sheets? They're in your week 1 module, right? You guys know where to find these? Yes or no?
Yes.
Yes.
Okay, so when it says see Canvas course, these are in your module. Week 2, you had introduction to some reading from the Intro to Maternity and Peds. Gave you very specific pages. Okay, Fundamentals book had a couple of chapters. Okay, and then when it says see Canvas course, you have a couple of education pages, one for the school nurse, one for lead exposure. That's in your week 2 module. That's where it's all accessed. Number 3, there was no book reading for this past week. See Canvas course. So we just, for those of you that I just went through it, you have 4 information pages in your module. One on migrant farm workers, rural population, homeless, and poverty. Okay. You also have 3 weeks of notes. Week 1, 2, and 3. Okay. And the notes coincide with all your readings. It's not additional. Okay. So I'd say the notes are more of a summary of your reading, but you're responsible for all this reading. Questions on the exam can come from anywhere in here. Okay. And then your notes are a summary of all of this. And then your study guide is the bigger summary of all of this. So your study guide includes information from your readings as well as information from your notes. Okay, so it's all connected. It's not three bulks of information. It's one bulk of information all pulled together. That's what your study guide is. Make sense? All right, so you don't have to go back to your syllabus and look at your readings. I've outlined it for you here. Okay. Number of questions, 50, multiple choice, select all and apply, math problems, 75 minutes. Review, I sent my group math handouts, some math resources, practice math questions. So if you struggle with math, I would encourage you to look at some of those resources. Then always remember safety first, ABCs. Does the question have what's the priority? What's the most biggest priority? What's the least priority? What's the first? What's the last? What's the greatest? What's the least? You got to be looking for keywords in your exam that make it a priority question. Like we just went through the quiz 1 in my class with the class I just taught. And one of the questions was, here's a whole bunch of kids who presented to the school nurse. Which one does she have to see first? Okay, and we just talked through why she had to see the 9-year-old who was coughing and couldn't participate in exercise, because that was an ABC question. It was the signs and symptoms of maybe an impending asthma attack. All the other 3,
I missed that one.
All the other 3 scenarios were the students have to be seen. One missed a medication, one had itching or something, and those will all get seen, but you had to prioritize which kid needed to be seen. And then make sure you can identify prevention levels from each of the chapters or each of the topics we covered. So that's in your week 3 notes. Okay. Let's go through prevention levels. One of the things that you need to be able to do with prevention levels, primary, secondary, tertiary, and ADPI, is you need to be able to, we are using those in community. So ADPI is your nursing process. Nursing process is used in your hospital and your long-term care facilities and your wherever you work, but it's also used in the community. It just looks different. And you have to be able to, how do we use our nursing process in the community? So it's still the same: assessment, diagnosis, planning, intervention, evaluation. It looks different from the hospital setting to the community setting. So you have to be able to articulate how prevention levels look and some of the topics we've covered. What would a primary prevention level be for homeless population? What would a secondary be for homeless population? What would a tertiary be for homeless population? What about vulnerable populations in poverty? What would be a primary prevention, secondary? So you have to be able to articulate in the different topics recurring. So let's start by what is primary, what is secondary, and what is tertiary. Let's just cover that right off the bat. What's primary?
Prevention.
Prevention. So primary is P, prevention. What's secondary?
Screening.
Screening. So S for S. I am recording, right? Yep. Okay. What's tertiary? What's T stand for?
Treatment.
Treatment. They already have to have the issue, condition, right? So we need to understand those and be able to articulate different levels of prevention for different topics. And we need to be able to articulate the nursing process, which is ADPI, to the different topics as well. It's not an all-inclusive study guide. I've done my best to pull everything together. But your best practice, right, is to prepare for the exam, is to review your notes, your weekly recordings. Let's say, you had to take a phone call for 20 minutes during the lecture. I would go back and find that lecture and review those 20 minutes. Okay, review your readings and your discussion questions that you did first 2 weeks. Your week 1 was a vulnerable population. Your week 2 is common childhood ailments. So your 2 discussion questions also are helpful. Okay, and then review the recordings. If you feel like you missed some or you want to review. And then lastly, attend, like you're doing today, attend your unit exam review sessions. Okay, and after all that's said and done, okay, if there are still things that you don't understand and you want to talk through, that's when you reach out to your instructor. Myself, Dr. Kershaw, will be me for next week because Dr. Kershaw is out of town for 10 or 11 days. So after going through, I'm happy to tutor. I love to tutor students. However, I need you to do your part as well. Okay. So once you have done all of this, I can't highlight it. Once you've done all of this and you're still having issues on certain topics, then reach out to me and we'll schedule some Zoom time. Make sense? But I need you to do all of this first, because I don't use tutoring sessions to kind of reteach. I just don't. For people that have missed content or missed class, I don't. It's not a productive use of anybody's time. I use tutoring sessions to review the specific areas that you're having a hard time understanding. Alrighty? So here it is. So I've broken it out to weeks 1, 2, and 3. Okay. You're going to need to know the difference between community nursing, community-oriented, community-based. As I've said to all my classes, this is the way I remember them. Community-oriented is big picture. You're focused on the population. Okay? You're focused on health promotion rather than illness care. You're focused on the big group, not individuals. Okay? If you're community-based, so it's big picture, oriented, you want to orient yourself to the community. If you're community-based, you're in the community. You're working in the community. You're providing care of individuals. You might be a school nurse. You might be an occupational nurse. You might be a home health nurse. You're providing care. Okay, it's illness care instead of health promotion care. Individuals associated as opposed to communities. So remember, community-oriented nursing is big picture. You're wanting to orient yourself to the whole community. Community-based is focused. It's in the community. Okay. Primary prevention. Here's your really good description. Prevention before it occurs. Secondary, screening, early identification, early intervention, early detection. Okay. Tertiary treatment. Okay, and hopefully all this sounds familiar to you because we should have covered it. When I put together my study guide, I should have covered, at least address the topic. This information shouldn't be new, right? So we've talked about uninsured, underinsured, the risks these clients have with regards to access. Vulnerable populations. Here's your list of vulnerable populations. Okay, and some information about vulnerable populations, which we've gone through. And then what's disenfranchisement? Okay, feeling like they're on the outside and they're forgotten, right? You feel disenfranchised, you feel kind of on the outside. Nobody's really paying attention to you. Those are those vulnerable populations, right? Maybe the poor, and I'm reading from here, the poor, the homeless, the migrant workers, they feel invisible. Okay. And then poverty, we've covered poverty. And the most important thing to remember is this very first sentence. I'm trying to highlight. Oh, I can highlight. All right. Very important. If you're asked, what is the primary cause of vulnerability? What's the answer? Hello? What's the primary?
Poverty.
Thank you. Thank you. Just highlighting a few things here. Important. But again, just because I'm highlighting the big sentence doesn't mean that you don't need to know the whole sentence.
Right.
Got it? This is a review. Not a comprehensive review, but it's a review. Bear with me. You guys following along with me so far?
Yeah.
Nothing, these topics shouldn't be new. It's a review. Disenfranchisement. I don't know if I specifically used the word disenfranchisement when I was doing my lecture, but we know that disenfranchisement is the vulnerable populations right here. Okay, the poor, the homeless just feel like they're forgotten. Okay, poverty. Right, we know that education plays a role, not because it's just related to income, but higher education leads to better choices. Right, I guess that would be what I'd pull out of here. Better education leads to better choices, right? Oh, and here's our term resiliency. Higher education increases self-confidence and resiliency, right? We just went through this in the last class. What's resiliency? Resiliency is the ability to try your best to reduce some of your risk factors for vulnerabilities. That's being resilient. I consider all of you guys extremely resilient because you are getting through this program, taking multiple classes at a time, and you are determined to successfully complete this program. That's resiliency. Make sense?
Yeah.
Disabilities. Talked about that as well, right? We know that complex physical or mental disabilities increase vulnerability. That's a given. Okay. Right? We know that veterans, here's the reason why they're a vulnerable population, right? Deployment can have a negative impact on the individual and their family. Maybe more domestic violence and child mistreatment, right? So number one, we know veterans are a vulnerable population, but here's why they're a vulnerable population. Okay, and read through that. What are some outcomes of vulnerability? We just talked about this. Pretty common sense. Lower health status, increased morbidity and mortality, high prevalence of chronic illness, increased levels of communicable diseases, high mortality rates. Right? You guys have heard this before, right? Please say yes. Okay.
Yes.
What are some interventions for vulnerable populations? You guys can read through this. Therapeutic communication. Limit the limit the hello. Limit the inconvenience of healthcare. What that means is access. Right? Access, and schedule visits on the same day for all family members. Make it more convenient. Resources, know your resources. And again, here, resiliency comes up. Recognize the role that resiliency plays. Okay? The more out of control they feel, the worse their decision-making becomes. But think about it. Think about you guys managing 3 classes. Okay? The more stressed you get, right? More worked up you get, the harder it is to make decisions, right? Then you end up getting nothing done. Is that true? That's true for me. Lack of resiliency generally leads individuals to make decisions that worsen their circumstances. Okay. Okay. Some other issues. Well, how do we care for the caregivers that are caring for the chronically ill? Right? We know the caregivers are at risk for mental illness due to burnout, stress, and they're at risk of neglect. Right? This is all about vulnerable. Yes, we talk about vulnerable populations, but what about the people who care for them? We need to make sure we understand about them. Okay, so that's a quick summary of chapter 1, week 1. And then week 2, what did we cover? We covered school nursing. School nurses triage many complaints. In prioritizing, follow our ABCs. That's what that quiz question was about. We know that children are prone to somatic complaints, physical complaints that may come directly from psychological issues. Okay, so for example, I just finished school nursing. I was a school nurse for 20 years. Okay, you get tons of kids coming in with headaches and stomach aches, and that's fine. What happens if you have a kid that's coming in at the same time every day for a week with a stomach ache, and you have evaluated, assessed that this kid doesn't have stomach aches? There's something else going on. So your role is to evaluate maybe what else might be going on. What's prevalent in schools? Bullying, harassment. Okay, so it's important to evaluate for underlying psych conditions that may contribute to their physical complaint. And that's where we talk about bullying. You know, they're struggling in a particular class. They're getting bullied in a class. They're coming down during class, on the same class every day. Okay. So you got to figure out, you got to do more digging. What might be going on? There might be a whole other set of issues going on that we don't even know about. They're just, you know, we're recognizing what's happening in school, but that may lead to a whole lot more problems going on outside of school, right? Maybe sexual, physical, emotional abuse, fighting at home. All right, some students will come to the office complaining of a headache or stomach ache to escape class that they're struggling in, or they're being bullied. And this is important as you're interviewing these guys. It's important to ask what's going on prior to the onset of the headache or the stomach ache. That's actually a really good open-ended question. What were you doing before you came down here? What were you doing before you came down here every day? And then maybe you call to the parents. Hey, Susie's been in the clinic 4 days this week, right in the middle of math class, complaining of a stomach ache. Are there issues going, does she have stomach aches at home? or is it just at school? Okay, so my point is you need to dig more if you feel like you need to. Okay, next subject in week 2 is obesity. Okay, rates of obesity in children have been rising for a variety of reasons, right? Not just diet and exercise, but environmental exposures. Okay, we know that the consequences of childhood obesity are lifelong. Okay, cardiovascular, respiratory, renal, menstrual, I mean, any system. Okay, and we know that we're still in school nursing. Obesity in children increase the risk of bullying, which comes with stress and contributes to more risks. Okay. And then next topic, injuries and accidents. We covered this in week 2. Okay. What are preventable accidents that are preventable are the highest cause of issues: falls, fires, drowning, suffocation, and on. Okay. Exposure to secondhand smoke. What are the risks of that? Okay. Well, that talks about for the infants, increase for SIDS, increase for a lot of things. Okay. So parents need education on the effects of cigarette smoking, and the effects it have on the kids. What about if you're doing a home visit and it's a smoking house and there's kids in the house with asthma? You got to deal with it. Got to come up with a plan, right? Because obviously the goal is a smoke-free house, right? What if the mom says, "Don't worry, I instead of smoking 2 packs a day, I only smoke 1." Is that okay? Is that
No.
right? No. What if they say, "Well, we smoke outside now instead of inside"? Okay, that's better. Better. What if they say we vape now and we smoke e-cigarettes? Is that good?
No,
Why?
because it also has chemicals in it.
Exactly. Right? So our goal is for a smoke-free house. How do we do that? Maybe we offer them resources, smoking cessation classes, ways to quit smoking. I don't know, but they need to understand the long-term effects of smoking with kids, and especially with kids who have asthma. Okay. This is with regards to child development. Okay. How do we educate parents about maintaining their kids' health? What should they know? It's all spelled out for you here. How often are regular checkups recommended? What about immunizations and boosters? Annual vaccinations, flu vaccinations. So parents should be taught to recognize signs and symptoms of pain if children are recovering from surgery. Okay. Iron deficiency. Test for iron deficiency of kids that aren't eating well. Nutrition. All right, before the kid enters preschool, physical exam that may include urinalysis. So this paragraph is about growth and development. What are the highlights of what we should teach parents? Okay, kids should be active. Whoops. Kids should be active for 30 to 60 minutes a day. That makes sense? American AAP, which is American Academy of Pediatrics, which we use for guidelines, recommends that no television, smartphones, or computers for kids under age 2. And less than 2 hours of screen time per day for children and teens. Good luck with that. Good luck with that, but that's their recommendations. Right? More screen time has been linked to increase in attention problems, unhealthy eating habits, higher body mass index, and obesity. Okay, so this is a nice summary of, where am I at? Educating parents about maintaining the child's health. This is all about suggestions for growth and development. Okay, so when you're doing your family assessment, your health assessment, like we talked about in week 2, this is a nice summary of what you can educate parents about. And we also talked in week 2 about health risks across the lifespan. Remember, if you're in community nursing, you're working with clients across the whole lifespan. Okay, and that's what the big difference is between community nursing and, let's say, hospital nursing or long-term care, where you're taking care of one population. Okay, you might be taking care of the elderly, or you might be taking care of the babies if you work in a NICU or whatever. Okay, but community nurse, you may be exposed to every group of population. Infants, you may be doing new parent visits, doing well child visits, weighing the baby, talking about bonding and feeding. You may be doing that. You may be in a school talking to kids about helmet safety and good nutrition habits and how to wash your hands. You may be talking to older kids about drug prevention, STDs, safe sex, prevention of adolescent pregnancies. You could be doing women's health seminars, men's health seminars. You could be working with families that have disabled kids. What resources do they need? You could be working with the elderly. So my point is there's health risks across the entire lifespan. Okay. And here they specifically address domestic violence. Can begin as early as teen relationships, right? And we're still talking with the school nurse. She needs to be open to the consideration that the relationship may become violent, right? Let students tell you about their relationships versus asking them. Trying to talk to teens and kids is like pulling teeth, right? Give them the opportunity to share what's going on. Maybe ask open-ended questions. Okay, so this is health risks across the lifespan. This is addressing teen violence. Okay. Okay, the second part we deal with is dietary modifications. Right? How educating families on diet can be extremely helpful and extremely preventative. Okay. Then it goes to common childhood ailments. And to be quite honest with you, I copied and pasted this from your week 2 notes. Okay, so that's your week 2 notes. And then week 3, this is what we just covered. Okay. Talks about depression in rural residents. Right? Why? Factors that relate to the level of depression, right? We just went through this. Poverty, economic difficulties, geographic isolation, insufficient workforce. Okay, there's a whole bunch of reasons. And it describes what the characteristics of rural life are. Okay. And again, we talked about this too. Rural areas have 4 primary high-risk industries. What are they? Right here. And why are they high risk? You need to know this. What are the 4 industries? Okay, and the rest of this paragraph goes through why they're at risk. And we talk about farm workers have the following health risks. They have several health risks, but I'm going to take it the first one, pesticide exposure. Why do farm workers have such a high risk of pesticide exposure? What's happening on the farms? Okay, that explains this right here. and then kids living on farms and their health risks. I copied this right from your week 3 notes. We need to know this. Since pesticide exposure is such a prevalent and very serious risk factor to farm workers, rural residents, pest exposure is one of the biggest. There's many risks, but pesticide exposure is the most common. So I've outlined it for you. What does pesticide exposure look like in the acute phases, chronic phases? So if they have they've had a pesticide exposure, you're really dealing with tertiary prevention, right? Because they've had the exposure. Okay. And then here's a little blurb about children living on the farm. This is right in your week 3 notes. And here's a nice little summary about migrant farm workers. Here's a really nice summary about homelessness, right? We know that it's correlated with poor outcomes. The incidence of acute and chronic illness is increased. Okay, and think about it. What might lead to homelessness? We just covered this, took this from your week 3 notes. Okay, some things of what might lead to homelessness. Substance abuse, domestic violence, a health crisis, unemployment. Okay, here's a good example right here. High risk for homelessness would be individuals facing multiple issues and lacking strong family support and social support. Maybe a veteran with PTSD struggling to keep a job and is estranged from his family and friends. That's a classic example of risk of homelessness. Okay, and then here's a really nice summary of the 3 prevention levels, and it's generic. Okay, so teaching new parents to role model healthy eating. Yep, we're trying to prevent obesity. Incorporating physical activity into every school setting, discouraging the use of taking away recess, whatever, as a disciplinary tool for the school setting. That's preventative. Advocating for the elimination of soda and junk food in the schools, preventative. Trying to prevent obesity. Providing developmentally appropriate sex education early. Prevention of unintended pregnancies, maybe unintended STDs. Providing education and appropriate adaptive coping mechanisms. Okay, maybe this will help prevent substance abuse, violence. Advocating for better housing conditions for migrant farm workers. You're trying to prevent them from having to live in unsanitary conditions, which would lead to many issues. Okay, and remember secondary, screening for early identification so it can be treated. Some examples: blood pressure checks, BMI, screening for financial instability. This is right in your week 3 notes. Why do we screen for financial stability? Because lots may be at risk for homelessness. Okay, so we want to screen them and try and get some early intervention so it doesn't get to tertiary in which they're homeless. Other things, examples of screening: TB tests, self-screening, lead exposure questionnaire, right? Questionnaire is a form of screening. You can do screening. How do you do screening? Doesn't mean you have to go to a facility and be screened for something. You could be sending out a questionnaire. You could be doing a phone interview. Okay, pap smears, mammograms, colonoscopies. Okay, so tertiary, treating, managing an existing condition. Okay, trying to improve the quality of life, try to reduce the symptoms. Teaching a client with diabetes to check their feet for ulcers. They already have diabetes. Teaching a family of a child with T1D how to time their insulin. They already have diabetes, right? Medication, teach them about side effects. They're taking medication for a condition. Same with type 2 diabetes. Here, this one is about hypertension. Teaching clients with hypertension how to follow a low sodium diet. They already have hypertension, right? If you're demonstrating the use of a glucometer, then they must already have diabetes, right? This one is obese people, providing diet and physical guidance to child and family. You get the picture, right? They already have something. And here's some additional topics to cover. There's 4 of them. Understanding motivation. Okay, what's motivation? Right? How do we motivate our clients to seek primary, secondary, and tertiary services and resources? To have a read through that. Right? To understand motivation, you need to learn these 4 things. Okay. Right. So motivation will most directly be impacted positively by interventions that provide information that's relevant from a trusted source. Okay. And then we do, I didn't review this, but I put in here, home safety. This goes along with the violence topic. This is in your reading. Okay, this is in your reading. It's not on your week 2 notes, but it will be for next term, but that's why I put it in here. Okay, so one of the Healthy People 2030 goals is to reduce firearm-related deaths. Right? We know that gun violence is a risk factor for accidental injury or death among children. Okay, so this is in your reading under the violence section. So let's say you're doing a home visit. How do you evaluate the client's home for safety? Okay, first you have to find out if they even have a firearm, right? That'll be your first question going in. Where's your firearm? Do you have one? Yes. Okay, can you show me where it's stored and locked? Right? Probably want to feel safe, right? So you actually ask. Find out where it's stored. And the guidelines are the firearms should be stored, unloaded, locked, ammunition stored in a separate and locked device. Okay. If you're a home health nurse going around doing visits, I sure want to know if I'm going into a household that has firearms. What if you're doing an unannounced visit? What if the courts have ordered you to do a visit? There's 2 kinds of visits in home health. There's voluntary and non-voluntary. Voluntary is usually, the going to visit new parents and see how they're doing with their baby, how's breastfeeding going, what help do you need, what resources. But what about the unannounced visits that you maybe there with a police officer and it's a court-ordered visit? Or it's a social services visit and you're accompanying the social worker. I want to know about firearms, making sure they're stored. Right? Does that make sense? These are things you just don't think about. And then another topic, educating parents on minimizing the spread of infections at home. What do you want to tell them? Wash your hands. When? Before eating. Before, during, and after handling and preparing food. Before dressing a wound. Giving medication. Contact lenses, right? Any contact with body fluids or blood. Changing a diaper. Right? I know it sounds like common sense, but you'll be teaching that, right? This would be primary, right? A primary intervention. You're trying to prevent the spread of infections at home. Okay. And then the last piece I added in here, it's in your reading, but I didn't cover it very well. Because you can't cover everything from the readings. That's why you have your notes and they supplement your readings, right? So what's a determinant? Understanding social determinants of health. What it means is what determines, that's what it means. What social factors determine about your health? Okay. So what social factors are we talking about? What's a social factor? Safe housing, transportation, racism in neighborhoods, discrimination in neighborhoods, violence education, job opportunities, access to nutritional foods and physical opportunities. Okay. These all affect some communities may be all right with all of these. People have safe housing, there's transportation, but other communities, these are determining factors. Right. So if you don't have safe housing, you don't have good transportation, you're probably going to be in an unhealthy state. Whereas if you do have these, this is what determines some social determinants of health. Okay. That's your study guide. What do you think? Helpful? Kind
Yes,
of
very.
brings it, kind of just brings it all together, doesn't it?
Yes.
If you've got a good handle on the study guide, you're going to be in good shape. If you don't have a good handle on the study guide, you go back to your notes, go back to your readings, and get a good handle on it. And then after that, if you still don't have a good handle on it, reach out to me. I just feel bad that we only have 6, 7 people here. So, encourage your buddies. They can't get here. I know a lot of people at class, but encourage your teammates to at least watch the recording. Okay, would you do that for me?
Yes, ma'am.
Anybody have any questions? Was this helpful? Hopefully. It's always helpful to go through study guides. And again, there is very little on that study guide that should not already be familiar to you. Right? If you've been attending class, if you've been doing your readings, if you've been looking at your notes, should all be covered. All right. Questions?
I just got a quick question.
Yeah.
Today's lecture and the review will be posted, the recording. Okay.
The lecture might already be converted. And as soon as I stop the class, this will start recording. It takes about an hour and then I'll post it.
Okay.
Sound good?
All right.
LaShonda, you've been with me for 3 hours. Has this all been helpful?
I just was like, I've been sitting in this chair since.
Right. I have too. I've been sitting in the same chair for 3 hours. Has this all been helpful? Lecture going into review.
Yeah, I will see once I take the exam.
Well, you'll be fine. You'll be fine.
I think so.
You'll be fine. All right, I'll stay on for whoever has questions. I'm going to stop the recording and everybody have a good weekend. Reach out if you need anything, especially Dr. Kershaw's group.
Okay.
All right.